Hi, this is Chris with DeClue Brothers Insurance Solutions. I wanted to come to you today and let you know a little bit about Medicare and some of the things that will be happening here in just a few months. The open enrollment begins on October 15th and goes through to December 7th. So for a lot of people, that is the time that you want to take a look at your Medicare policy and decide, do I want to make any kind of changes to another company? So I've come up today with 5 reasons that you would want to have a reason to look at another insurance company. So one of the first reasons would be is, what if you lost your doctor? So that's a big concern for people. You develop a relationship with them, you want to continue to use them. If it's a very well-known or very good doctor, then certainly you would love to keep them and move forward with whatever treatment that you have. So if you lose your doctor with your current insurance plan, now's the time to look at changing if you have lost your doctor. So that's one reason. A second reason would be prescriptions. Well, what if you started off the beginning of the year and your prescription coverage was working fine, but you know what, you're about 3 months in, now all of a sudden something's developed and the doctor's put you on a new prescription. But however, that prescription wasn't covered by your insurance plan. They all have formularies. The formularies are basically the list of prescriptions that each carrier carries and will cover on that particular plan. So if a prescription is not in their formulary, then it is never going to be covered. Now, so if you happen to have that situation, that's a reason that you'd want to consider changing companies. A third reason that you would want to consider looking at an insurance plan for the upcoming open enrollment would be if you've moved. You know, change of from one county, even change from one part of the county to another part of the county. That is a situation where you're obviously you're far away from the doctor that you had, and you want to try to make sure you get back to a new doctor in that situation. A fourth reason would be doctor copays, specialist copays, or copays for anything for that matter that you're having to typically spend now that you didn't before. Each year, these insurance companies will all jockey to be able to offer the best copays that they can give you. So if your copay situation has your copays on your current plan has increased, or if you just started using it and you really didn't know what you had in the first place, then that would be a good reason to consider looking at an insurance plan for the open enrollment. And then lastly would be referrals. Let's say that you started off the year, you were in great health, you never thought you would ever use the insurance, never expected, you just kept it for catastrophic reasons. Then one of the very important things is now that you're using it, you realize, wow, I don't really like the way this plan works. So there are still companies out there that offer no referrals and give you some flexibility to go to different doctors without having to go through a gatekeeper.